And good morning, members and guests. I'm Dr. Jung from Seongnam, Korea. My topic is the effect of the addition of new portable perineometer during pelvic floor muscle exercise in women. We performed the multi-center randomized trial for this. I have nothing to disclose, and I received the research fund for this study. There have been controversies on the apparent effect of the combined biofeedback to pelvic floor muscle exercise. A recently developed portable perineometer named Kegelq device has several characteristics different from existing ones. The silicone probe can expand evenly, not overly in shape, enabling the patient to perform the exercise effectively no matter how deeply the probe is positioned in the vaginal cavity. In addition, the feedback can be provided more effectively by the actual pressure value and the changeable monitor color, as well as the graph. 90 eligible women with SUI symptom for more than 3 months and positive response on scientific questionnaire number 1 and 2 grams or more in 1-hour PET test were randomly assigned to 2 groups. This is a study schedule. One group performed the pelvic floor muscle exercise only, and the other group did pelvic floor muscle exercise combined with biofeedback with the Kegelq device for 12 weeks. Primary and secondary outcomes are these factors. There were no significant differences in the clinical demographic characteristics between groups at baseline. And the comparison of both groups in intention to treat method, the objective cure rate was 49.9% and 64.4%, both for exercise only and the biofeedback group, but this is not significant. Among the secondary outcomes, IQR index total score, PPBS, and scientific index, and change of 1-hour PET amount were improved significantly more in biofeedback groups, and strength of pelvic floor muscle was also increased in biofeedback, more biofeedback groups. And the multivariable, the logistic regression, the addition of new device was the predictive factor for the meaningful improvement of total IQR scores. Visual analog scale on the inconvenience during the use of Kegelq device was just 1.8. So in conclusion, although the addition of the Kegelq device did not statistically improve the objective cure rate compared to exercise only, quality of life and other measures of SUI symptom severity were significantly more enhanced with the use of Kegelq device. It may be used daily at home as a useful adjunctive treatment to pelvic floor muscle exercise. Thank you.
Do we have any questions?
Beth Shelley, physio from the U.S. I'm just wondering if you had enough patients in your pool to tease out some of the different types of diagnoses or age groups to identify whether there might be a way to predict which patients, which types of patients could possibly benefit. It sounds like you pooled them all together. Did you have ability to separate?
No, sorry, we did not check separated the factor you suggested, but in this study, most of patients had the SUI predominant symptoms.
Okay.
Yeah, just.
Would be nice to try to tease out some of those factors so we can see if it's appropriate for some groups.
Okay.
Mandy Pulliam, U.S. I wondered, you reported on the adherence of both of the groups. How did you keep track of that or monitor it?
Pardon?
How did you keep track of adherence?
The treatment compliance, adherence, you mean?
Yes, compliance.
Okay, yes. We define the treatment compliance as the over 80% of the exercise in relation to the predefined the count of the exercise. So we use the treatment calendar to document their treatment event. So the physiotherapist used the calendar, the treatment calendar, to check the compliance. So we can identify the similar compliance between both groups, about the 75%. Yeah.
Thank you.
Thank you for your presentation. I was just wondering, maybe I missed it at the beginning, when you compared your two groups, did you have information about initial pelvic floor muscle force or pressure, and was it equal between the two groups?
You mean the difference of
the possibility to contract the pelvic floor, was it presented? I didn't see that at the beginning.
In the start of the pelvic floor muscle exercise, the one therapist per each hospital who have trained about the standardization of pelvic floor muscle exercise instruct to patient to perform the pelvic floor muscle exercise at home. So. And then, so the strength of pelvic floor muscle exercise, the strength of pelvic floor muscle was equally between both groups. So I think the randomization and the competence of treatment education is the same between both groups.
Thank you.
Thank you.
I think that will have to be the last question. Sorry. Thank you very much.
But don't let that stop your scientific pursuits. You can talk to him after the session. Okay.